Check, check, hey.
Hello. How are you?
All right.
What's your name?
Crest Thomas.
Crest Thomas.
Crest Thomas.
Are you-
Play today in Washoe, Cumberland County.
Nice to meet you. I'm Kelly Wilson.
Chairman Deviere?
Thank you, Ms. Rice, for your assistance in this. To the press, thank you for being here. We do appreciate you taking the time and helping us continue to put out a credible source of information on what's happening around the federal shutdown. We just concluded a meeting of the Board of Directors, or excuse me, Board of Commissioners around this topic, and just wanted to give the press an opportunity to answer any questions with some of the speakers, if they had any. But I wanted to give a couple comments before we move to that. We're here today because while the federal government remains shut down and funding for many services is projected to run out, Cumberland County remains open, responsive, and ready to support those impacted. So I want to be clear, our priority is keeping our residents informed with credible information, safe, and supported, no exceptions. We're hearing from families, seniors, and federal employees who are worried about what comes next. That's why we're here. We want you to hear it from a credible source. And I want you to know that no one will have to face this alone. Thousands of households in our community depend on food and nutritional services. Federal funding delays will create real uncertainty for real people. That's why our community leaders and partners have already begun the mobilization and are trying to lean forward to anticipate the challenges that we may see that we can solve together as a community. We're coordinating with local nonprofits and faith-based organizations right now, not waiting, not watching, but acting. We're working alongside with our towns, our cities, our community partners to identify needs early and to prepare those resources for those who need them most. We've also recognized the weight this places on our soldiers, their families, and civilian employees at Fort Bragg. We're in regular contact with the installation leaders to monitor emerging needs and respond quickly. Cumberland County is resilient, but our real strength isn't just endurance. It's how we show up for each other every day, and in moments like this. That's when it truly matters most. I'm going to ask Vice Chairman Jones to come up and provide some brief remarks before we move to some of the subject matter experts. Vice Chairman Jones.
Thank you, Chairman Deviere. Cumberland County's strength is found in our community. From seniors to youth, to each person plays a vital role for helping our neighbors through challenging times. So we know that many youth and young people, especially many of those that are having challenging times already, rely on free reduced meals through our schools. The county is working very closely with our community partners to make sure that all families have access to what they need the most. Many of our seniors already live on fixed incomes. We're working alongside our faith-based communities to help with meals, transportation, and support. The county understands the importance of the services providers, as well as working with our partners for nonprofits. We will continue our valuable partnerships and collaborations with Juvenile Crime Prevention Council youth programs to keep these positive programs going. Cumberland County CommuniCare is also another source we will continue to work with, and several other nonprofit organizations that make a very positive impact in the lives of many families. It is our goal during unforeseen times to support our youth during challenging times with access to positive youth resources. Today, we call on our community to be present, to help identify the needs of our neighbors, and to remind each other that help is definitely available. Whether it's through your local churches, food pantries, or volunteer networks or shared compassion, we will make the difference working together. Together, we will ensure that every child, every senior, and every family will feel the seen and know that they are seen. Because we care, we will continue to support them during this time. Now I will turn this over to our county manager, Mr. Greer, who will share more of the ways that our staff plans on helping to support our community.
Good afternoon, everyone. I'm Clarence Greer, County Manager. Our county continues to operate without any interruptions. All essential services continue to be active. We have coordinated with the department at North Carolina Department, DHHS, to keep up with information regarding this shutdown and how we deploy services moving forward. All county departments are working together to ensure that information gets to the citizens and community partners to make sure that they can make the critical decisions and provide the critical services to the community. Our employees who continue to show remarkable dedication and serve the community with professionalism, compassion, and pride. And Cumberland County is ready to be steady and committed to serving our residents. And I'll turn it over to Brenda Jackson and Dr. Green, or Brenda Jackson right now, to give us an update on our food and nutrition programs. Thank you all for today.
My name is Brenda Jackson. I'm the Director of Cumberland County Department of Social Services. At the Department of Social Services, we administer the SNAP program. That's what it's called on the federal level. At the state level, it's called Food and Nutritional Services. We serve 33,000 households as it relates to food and nutritional services, or SNAP benefits as it's called on the federal level. While October benefits have been issued, we have been notified by the North Carolina Department of Health and Human Services that USDA has informed them that November services may be disrupted or delayed if the federal shutdown continues. We are in close contact with the Department of Health and Human Services and our other stakeholders and advocacy agencies, and will provide updates as soon as information is released to us from USDA. We are encouraging families to do several things. First, for those SNAP benefits, those that are already receiving, we encourage you to go and make sure that you understand that you can continue these benefits. If you have benefits on your card today, you can continue to use those benefits at any time. You can go to ebtedge.com or the EBT Edge app, and there are several numbers on the back of EBT cards in which citizens can look and determine how much benefits that they have left on their cards. And remember that those benefits can be used at any time and can carry over month to month. Continue to apply for assistance for those citizens who need food and nutrition or SNAP benefits. We are open, and we encourage you to continue to apply. We will process those applications, and when funding is available, those benefits will be issued. We ask citizens that are receiving benefits to make sure that they conserve their benefits, making sure that you're buying shelf-like stable items, such as, it's a good time to make soup. I said that earlier in the commissioners meeting. It's a good time for a pot of chili or a can of soup. Our team is working with our community partners and operating food banks and community meals, and those that are conducting outreach to help make sure, as have been previously said, that our community stands ready to support those individuals who have needs for food assistance. We want residents to know that DSS stands open. If individuals need to apply for benefits, you can come to our main office at 1225 Ramsey Street, as well as they can apply online using epass.nc.gov. Again, they can apply online using epass.nc.gov. So for our citizens that may have transportation issues or challenges, you don't have to come to 1225 Ramsey Street. You certainly can apply online. Again, we stand open and ready to serve. At this time, I'll turn it over to Chairman Kirk deVier.
And I'm going to turn it over to Dr. Green.
I'm so sorry.
We're flexible.
Good afternoon, everybody. My name is Jennifer Green. I serve as the Director of Cumberland County Department of Public Health. The Health Department operates our Women, Infants, and Children program. That program serves more than 12,000 participants annually, and that program contributes more than $11.2 million to our local economy through WIC benefits that are expended in our local vendors and with our local grocery stores. As noted earlier, our North Carolina Department of Health and Human Services has informed us that they have secured funding for WIC benefits for both food and administrative expenses and operations into the month of November. Assuming that redemption levels remain stable, and with ongoing incremental funding, WIC can operate through November the 15th. Additional federal and or alternative funding sources would be needed for benefits beyond that time if the federal shutdown continues. We continue to work with our partners at the state level and with USDA to secure those funding opportunities. Our North Carolina WIC office and our local WIC offices are open and operational for business. That includes all 4 of our locations here in Fayetteville, Hope Mills, Spring Lake, and our office on Fort Bragg. Our families that are currently enrolled in WIC are encouraged to continue to use their WIC benefits as usual this month. We continue to work again with our state health department and our local WIC staff to make sure that our WIC participants are well informed and they'll receive that direct communication from our North Carolina WIC office. And we will be in communication with our WIC vendors if any changes should occur due to the shutdown. WIC participants should maintain their normal appointments with our WIC team, including those regularly scheduled appointments. If you are looking to be a new WIC participant and you are eligible, you can continue to enroll at any of our 4 locations here in the community. Our team is ready to support our residents. We have 2 lines, phone numbers that I want our public to remember. One is our information line. That's for our general information about WIC benefits, 910-433-3610. And then our appointment line, if you need to make an appointment, change an appointment, is 910-433-3730. We stand ready to serve our community, and we appreciate you being here today. And I'm going to turn that back over to, I believe, our 211 update, and so I'll turn it over to our United Way director.
Good afternoon. My name is Scott Embry. I serve as the Executive Director of the United Way of Cumberland County. The United Way of Cumberland County and our agency partners in the wonderful nonprofit community that serves Cumberland County, we exist to make sure our neighbors have access to resources and information when they need it the most. By dialing 211 or visiting nc211.org, everyone that needs help is just a call away. 24 hours a day, they have access to resources, information about food pantries, meals, housing assistance, utility assistance, and mental health services. Calls are completely free, they're confidential, and available in multiple languages. Our operators are well-trained to listen and to help route people to the correct resources that they need. I will also mention that every resource on 211 and every organization on that platform have been vetted. They are accurate, that when you call, you know what you're going to get, and that gives us a lot of comfort, especially in times like this. Accurate information is certainly very important in this day and hour. During these times, we like to remind the community that we are not alone, that help is just a call away. I appreciate the opportunity to be here. I'm going to turn it back over to Chairman Deviere.
Thank you, and thank you to all the participants. We're going to go ahead. I'm going to save some closing remarks, but I want to go ahead and open it up if the press has any questions. And again, if you can step to the mic if you have a question and let us know who it's for. If I need to have, I'm sure most of them are going to go to Dr. Green and Director Jackson. But if you have questions, will you please step to the mic at this time? And if you'll just state your name and who you're with.
Myron Pitts, Fayetteville Observer. I'm not sure who is best to handle this question. Maybe you, Chairman Deviere. So we've heard November 15th is kind of, we're good in terms of WIC and SNAP until then. My question is, when will we know that the shutdown could extend things to where where we don't have the funds by November 15th, and when will planning for that start?
Yeah, I think that's a great question, Myron. Thank you. As the county manager spoke to the board earlier, this is really a fluid situation. So every day we're gaining information. It's why it's important that we stay connected with our congressional offices, like you heard Ms. Smith at the earlier board meeting. It's why we stay connected to the people that work with us in D.C., as well as back through our state agencies as well, because this is a fluid environment, and we'll know day to day. To your point on when do we start planning, we've already started planning. We wanted to be a community that's leaning forward and leaning into being prepared and not being reactive. We hope and pray that we don't have to do anything. I'm hopeful that we will see a solution at the federal level that so our communities and many others across the state and nation won't be impacted. But it's fluid, and we're moving day by day. I would encourage you to keep updated with relevant information. Again, credible source of information. Come to our website, cumberlandcountync.gov, the DSS website, or the Department of Health website for the latest and greatest. And we will actively push out that information as we get it. You'll see it on our social media pages and through our other communication channels. Other questions? Do you have a point yet? Sorry.
Brenda Jackson with Social Services. I just want to clarify, I think your question was about WIC and SNAP being November 15th. I want to clarify that we do not have a date for SNAP. We've only been told that benefits are issued through October, and they may be disrupted or displaced for November, but we haven't given a date. So I want to make sure we clarify. Thank you.
Thank you, Director Jackson. See, I knew I should have got out of the way and let the experts answer. I'm going to do that this time.
And that would, Dr. Jackson, would apply to 33,000 households, is that correct?
That's correct.
So we got 33 households possibly going to have benefits disrupted or taken away in November. On the WIC program, November 15th, it's 12,000 households, is that correct?
Not households, individual participants.
Individuals.
So that would be the mom, baby, or an infant. And so that might be multiple people in one household.
Okay, and then this morning I saw a pay stub from a teacher who works on Fort Bragg, and it was $0. And the hospital, because of the situation with the state legislature, is tracking to lose 3 to 10% of its Medicaid reimbursements. So there's a train coming at us hard and fast. And this is a result of our lawmakers in Washington and Raleigh failing to do their jobs. They were elected to pass these budgets, and they did not. What pressure are you putting on them to make them do their jobs?
Thank you, Paul, for that question. We continue to stay in communication with them every day to understand where they are, how we can be of assistance in finding a solution, both at the state level with Medicaid, as well in the reimbursement rates, which you spoke to, as well as at the federal level with the pending cuts and the cuts that we've already seen. You know, when I served at the state level, at both levels, these are negotiation points. And so I want you to know that we are advocating as a body for a solution. And we're doing all we can to continue those conversations, provide any solutions that we can, any recommendations that we can, or any information that they need from our standpoint. But I think our biggest responsibility is, while they're working through trying to find a solution, that we actively take care of the citizens of this community. And that's what this is about. That's exactly what this meeting today and the groundwork that our community partners have been doing for the last several weeks. That's ensuring that if there's not a solution, God forbid, that we are prepared and we're ready, and that we can, to the best of our abilities, take care of our neighbors, because this community is at its strongest when we do that.
They made a mess, and you're having to clean it up.
What we're focused on is focused on taking care of the citizens in our community. We can't control what's happening at the federal level. I can't control what's happening with Medicaid at the state level. But what we can control is that room of community partners you saw earlier, both in the room and online, that is lean forward, ready to take care of the citizens in this community. That's what we can control. That's where I'm going to stay focused. That's the best use of my energy. That's the best use of this team's energy, as well as the community partners that we have across this community. That's where I plan to stay focused, and I believe our board and our community will stay focused as well.
Okay. Like to-
It's going to be short. Thank you, Mr. Chairman. Thank you for that question, Paul. And my input on that is that, yes, we have responsibility, and I totally agree with you. You can put that on the record. And as for me, the actions I choose to take, as you all know, I come from advocacy and nonprofit. I will be putting in place a petition for those that would like to sign it. I also will be bringing forth at our next work meeting a resolution that I would like to see signed. I don't know who will vote in favor or not, to inform our legislators and for a letter to be sent to our legislators as well as to the federal government. That's the action I will be taking as the vice chairwoman, and we will, I guess, see if it gets supported or not. A petition, number one, we do need to know, you're absolutely right, to allow individuals to know that we're going to support our community, but these actions are not acceptable, because you're absolutely right. They have a job, and so do we. So those are the two actions that I plan on taking. Petition that I will be asking anyone in this community to sign that chooses to, and that I will be going to our board to see about a resolution for a letter to be sent about the fact that it is unacceptable. Thank you, Mr. Chairman.
Thank you, Vice Chairwoman.
This morning, I heard from someone in law enforcement that there are concerns that when the food benefits stop, that people will start shoplifting food to feed their families. What are we doing to prepare for that?
Yeah, so that's a great question. Public safety is, of course, a concern, and one that our local law enforcement and our public safety officials have been having those communications. We know we may see some heightened activity around different things, but we also, when we look at that from a public safety standpoint, we also want to be educating on, if somebody doesn't have heat, they're going to be heating their homes in a different way. So again, I think you have a community that is coordinating. We're talking between the agencies in the areas that we spoke about earlier. One of those is public safety. And I think you'll continue to see a community that is as prepared as we can be for the situations that come at us. Any other questions?
I'll text you later.
Thank you, Paul. We appreciate your questions, and we appreciate your passion. Any other questions from the press? Yes, sir.
Yeah, thank you. Again, Myron Pitts of The Observer. This one comes to me from the community, i.e. Angela Tatum Malloy, right next to me.
Right beside you.
Yes. So some people, another consequence of the shutdown is that some people are going to be furloughed out of jobs, and they'll be applying for potentially things like WIC and potentially SNAP. So the question is, will their applications be expedited in any way due to this, or does it just go through the normal process?
Director Jackson.
Brenda Jackson with Social Services. We are getting guidance from the state regarding applications for citizens who've been furloughed. They will come in and apply for benefits and be assessed under the federal regulations in which we're required to administer the program in. And so, you know, the challenge with furloughs is in the sense that those employees will also get that back pay. So we're looking for guidance from the North Carolina Department of Health and Human Services in terms of how to count that income. But we want all furloughed individuals that feel like they have a need to come in and apply for our services.
Similarly for WIC, we want everybody that believes they're eligible to come in, be assessed. We are still taking appointments for individuals that may have their income changed due to the furlough. We check those pay stubs. So we always encourage, if you've had an income change, we want you to come in so we can make that assessment. We are going to continue to take those applications through November the 15th. And then we're, again, as Brenda said, for WIC, we're getting guidance about after that November 15th deadline, if we can continue to take those applications and what that process is going to look like. But if people have had an income change, we want to make sure that they're coming in. You might have been eligible, not been eligible last month, but you might be eligible this month due to the shutdown. So we want to make sure that people know that, and we can help them work through that process.
Thank you, Dr. Green. Any other questions? Yes, sir.
Dr. Jackson, do you anticipate effects on the LEAP program?
So what we know right now is that those individuals that are in special needs category 60 and older that received this low-income energy assistance program, if they received it last year, they will get an auto payment for that. We have been told by the state that that will happen. The LEAP program does not open until December 1st. It opens December 1st for those 60 and older, and in January 1st for everyone else. So as of right now, that's the only information we have received. Hopefully, the shutdown is resolved and we can stay on track with opening that program on December 1st.
So if it's not resolved, you might not have funding for it?
We've only been told about the auto for the special needs. We have not been given any other guidance on the low-income
For
energy
people who don't have
sources.
special needs?
Excuse me?
So some people who don't have
Right,
special needs?
that's right. We haven't received guidance for that.
Okay,
That's correct.
thank you.
You're welcome.
Any other questions? All right, again, I want to thank the press. Oh, I'm sorry, go ahead. Yes, sir.
Yes, Cress Thomas, Watch Out Cumberland County. My question is, if the food or SNAP is interrupted, how can nonprofits or faith-based organizations come together in the community maybe to help with food drives, food distribution? And I know there's Thanksgiving coming up and stuff like that. Is there a way they can join in or be added to 211 or something like that?
Thank you, and that's a great question, and I think you kind of answered it. So we want to connect them back into 211, make sure they're part of that system, so that when people have a need, they can call a central number and get those resources. I think we're going to continue, again, this is the front collaboration. We're talking with our faith-based communities. We're talking with Second Harvest. You know, you just saw United Way do a huge packing of food. So there's opportunities that we will, again, socialize in the community, working with our community partners that we have a network of now to make sure that those things are available and accessible, and we inform the community as well.
Is there a contact number for these nonprofits to try to join, I guess, into
So
the
into
efforts?
211, you want to speak to that?
Yeah, if you go on to nc211.org, you can add your agency. So any agency can be added to that. There is up to 7 days for vetting that organization, like I mentioned earlier. Everybody listed has been vetted. So, but within 7 days, anyone could be added. And it is already a great mixture of nonprofits and the faith community. A lot of those food pantries that our churches are standing up are already listed there. So it is coming together. It is a wonderful resource, but the more the merrier. Thank you.
And I just want to add, so as we continue to get information or people have questions that we may not have answered, again, cumberlandcountync.gov/resources, but you can go to the main website and there'll be information there, continually updated, but also a point of information or a point of contact so you can get information if you have a specific question. Anything else?
That's it.
For you and Pavan? Pavan, you also, please come up. So if this continues to move forward with no end to the shutdown, what do you anticipate might be done politically in terms of perhaps primarying the lawmakers who failed to do their jobs, Pavan on the Republican side and Kirk on the Democrat side?
Well, and I'll let Commissioner Patel speak, but, this isn't about partisan politics right now. This is about how we're helping a community. And I appreciate your question, but what we're standing up here doing is about how we're impacting our community and how we're helping the people in our community. This isn't about partisan politics or politics in any way. So I prefer to stay focused on how we're helping people and the resources that are going to be provided and working towards a solution versus the partisan politics. And that's not why we're here today. That's not why we're in this dais. And when we stand up here, we represent all the people, whether you're Democrat, Republican, unaffiliated, or whatever. That's who we stand up here and represent. So this is not about partisan politics.
Well, go ahead.
Thanks, Paul. I'm not the most political when it comes to this, but I think the chairman said it right. This is more about just taking care of our community, our neighbors, our friends and family, and hopefully, leadership at the state and federal level, they'll get together and maybe we don't have to go and take, any action, but right now it's just getting ahead of the ball and making sure if we get to a point that, we're supporting ourselves and what our role is to govern here locally. So I appreciate the question. I don't really have any other input than just I want to take care of Cumberland County.
Well, I think it's fair to say you guys are addressing this in a nonpartisan way, but it is being framed in Washington definitely as a partisan fight. In Raleigh, it's more of a Republican versus Republican thing. But either way, the leadership are failing to do what they were sent there to do, and we have a system to replace them. You guys are having great difficulties because they are not doing their work. They're not doing their jobs. They are way overdue with their deadlines. Something has to be done. What are you going to do?
So again, I believe our efforts and the use of our efforts and the use of our energies and resources are focused on things that we can control. I can't control the negotiations at the federal level. I can't control the negotiations at the state level. But what I can control is ensuring we're marshaling these resources, we're providing credible information to our community. That's what we can do in this moment to impact and affect the people in our community. And more importantly, take care of them, as you heard Commissioner Patel say. So that's where our focus is. Control what we can control, and this is where we can make an impact. Anything else?
Unless you have more? Okay.
I appreciate your passion, Paul, and thank you. I think we're just trying to take care of our town and community.
Any other questions? All right, again, I appreciate the press being here. I appreciate the partnership that we have with our local press to ensure that we are putting out credible information. You have a central point of information. Again, our website, CumberlandCountyNC.gov. Please go to nc211.org as well. Connect to 211 if you need assistance or there's someone out there that needs assistance. You can continue to call 911 as well. But what I want to leave you with is, again, this is today's meeting, today's board meeting, as well as this is to ensure that the community has the information and they're hearing it from the leaders in this community. They're hearing it from the subject matter experts so they can clearly understand. But I also want to send a very clear message to Cumberland County that we will be there with you. You will not be left by yourself. That we are working together as a community, and this community is resilient, and we're at its strongest when we help each other. When we work together, when neighbors help neighbors, when we all come together. We have a great system to do that. Will there be hiccups? Yes. Will we have a plan for everything? No. But what I know is this community is best when we come together. If we get to a point that we need financial resources, additional financial resources in some of these places, we'll have a system in place to this community is very philanthropic and they're very giving. They have a huge giving heart. And we'll have those things in place in partnership with United Way to facilitate those needs. So this is laying the groundwork for what we will have to do if we begin to see these challenges in our community. I remain prayerful and hopeful that we will see a solution, that we will see resolution at the federal as well as at the state level, and we won't have to do any of this. But this is who we are as a community. This is what makes us strong. This is what separates us from a lot of people. And I know that this community will take care of our own because that's what we can impact at this time and at this moment. So again, thank you for being here. And please continue to look out for our communications, both on social media, through our press releases, as well as online on our website at CumberlandCountyNC.gov. Thank you so much.